Health is much more than the absence of disease. It's about well-being. It's about having the opportunity to live a long and fulfilling life. Critical health psychology recognizes this. It goes beyond the individual. It examines how social, political, and economic factors shape our health. This field understands that our health is intertwined with the health of our communities. Traditional health approaches often focus on individual behaviors. They might blame a person's lifestyle choices for their illness. Critical health psychology challenges this view. It argues that factors beyond our control play a significant role. These factors include poverty, discrimination, and lack of access to quality health care. Critical health psychology emphasizes social justice. It aims to create a fairer and healthier world for everyone. It recognizes that everyone deserves an equal opportunity to be healthy. This approach calls for a shift in perspective. We must address the root causes of health inequities, not just the symptoms. By understanding the broader context of health, we can work towards effective solutions. We can create a world where everyone has the chance to thrive. This means dismantling systems of oppression and promoting equitable access to resources. Critical health psychology provides the framework for this vital work. Critical health psychology challenges traditional healthcare practices. It questions the assumption that healthcare systems are inherently neutral. Power imbalances can perpetuate health inequities. Traditional models focus on treating illness rather than preventing it. They may not address social and economic factors. Critical health psychology calls for preventative care. It emphasizes culturally competent care. By challenging the status quo, it paves the way for equitable healthcare. Power dynamics permeate all aspects of health. They influence who gets sick, who has access to care, and even how health is defined. Critical health psychology examines how power imbalances create barriers to health equity. It aims to dismantle systems that perpetuate health disparities. This requires challenging discriminatory policies and practices. By acknowledging the role of power in health, we can create more equitable systems. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These factors play a significant role in shaping health outcomes. Income is a prime example of a social determinant. People with higher incomes tend to have better health outcomes. Conversely, poverty is linked to a wide range of health problems. This includes chronic diseases, mental health issues, and lower life expectancy. Education is another crucial determinant. People with higher levels of education are more likely to make healthier choices. By addressing these social determinants, we can create a level playing field for health. Section 5. Confronting health inequities. Health inequities are avoidable and unfair differences in health outcomes. They are often rooted in social injustices and systemic discrimination. Critical health psychology is deeply concerned with understanding and addressing these inequities. It recognizes that everyone deserves an equal opportunity to be healthy, regardless of their background. These inequities manifest in various ways. For instance, racial and ethnic minorities often experience higher rates of chronic diseases. LGBTQ+ individuals may face discrimination in healthcare settings. People with disabilities may encounter barriers to accessing appropriate care. Critical health psychology seeks to dismantle the systems that perpetuate these disparities. This involves challenging discriminatory policies and practices. It also means advocating for equitable access to resources, such as quality healthcare, education, and employment opportunities. Confronting health inequities is not just about closing gaps in health outcomes. It's about creating a society that values the health and well-being of all its members. It's about ensuring that everyone has the opportunity to reach their full potential. Section 6. The power of community in health. Critical health psychology recognizes the power of community in improving health outcomes. It emphasizes the importance of community-based interventions and participatory approaches. This means working directly with communities to understand their needs and develop culturally relevant solutions. Community-based interventions can take many forms. They might involve creating support groups for people with chronic illnesses. They could focus on improving access to healthy food options in underserved neighborhoods. Or they might involve empowering communities to advocate for policies that promote health equity. Participatory action research is another key aspect of this approach. This involves engaging community members as active participants in the research process. This ensures that the research is relevant to the community's needs and that the findings are used to create meaningful change. By harnessing the collective wisdom and resources of communities, critical health psychology can help create more effective and sustainable solutions to health challenges. This approach recognizes that communities are not just recipients of interventions, but active agents of change. Section 7. Taking action. From research to advocacy. Critical health psychology is not just an academic exercise. It calls for action. It encourages individuals to become advocates for social justice and health equity. There are many ways to get involved and make a difference. One way is to pursue education in this field. By deepening your understanding of the social determinants of health and the impact of power dynamics, you can become a more effective advocate for change. Volunteering your time to organizations working on health equity is another powerful way to contribute. This could involve working at a local clinic, supporting community gardens, or advocating for policy changes. Staying informed about health disparities in your community is crucial. Attend town hall meetings, read local news, and engage in conversations about health equity. By raising awareness about these issues, you can help mobilize others to take action. Finally, consider supporting organizations working to address health inequities. This could involve donating your time, money, or skills. Every contribution, no matter how small, can make a difference. Section 8. Your role in creating a healthier world. Creating a fairer and healthier world requires a collective effort. It demands that we challenge the status quo, dismantle systems of oppression, and advocate for social justice. Critical health psychology provides the framework for this vital work by highlighting the interconnectedness of social factors and health outcomes. Each of us has a role to play in this endeavor. Whether you choose to pursue a career in public health, volunteer your time, or simply educate yourself about these issues, your actions can contribute to a more just and equitable world. By understanding the social determinants of health, acknowledging the impact of power dynamics, and embracing community-based solutions, we can create a world where everyone has the opportunity to thrive. Remember, health is not a privilege, it's a fundamental human right. Let's work together to make this right a reality for all.